everybody, 'tis I, the Rumpled One. Yesterday, I was kind of on a rant about insurance. Well, I think maybe I should continue the rage. Let's talk about medical insurance. Actually, you probably don't want to talk about it. You know, healthcare, Obamacare, that's big in the news. But it doesn't really solve the problem, does it? Because we know governments are inefficient. I'm in the process of reading this book. I'll tell you about it in another video. But the author says that private industry isn't very good with health care. Well, I mean, there's all kind of things when we talk about health care. Number one, you do not have the right to health care. That's not a right. No, I've already done a video about what 3 rights you have. But health care is not a right. So, the government shouldn't be involved in it. Period. Now, I've got an idea. I've had this idea for a couple of decades. I think you probably are familiar with the idea of a credit union. Or you might be familiar with the idea of a co-op. It's where a small group of people get together and put their money into a pot, and then it benefits all. For example, let's say you live in a small town, maybe 1,000 people. If each person paid $100, 1,000 times 100 is $100,000. Do you think you could hire a doctor, pay them $100,000 a year, and then anybody who comes to see him may have to pay a small visit fee, like maybe $10? You think that would work? Now maybe the numbers aren't quite right. Maybe everybody would have to pay $200. But it seems like that's an option. So maybe instead of having those $1,000 visits to the ER, like if you cut your finger or something, you could just go to your co-op doctor and he'd stitch you up for a lot less. And, you know, while we're on the topic, did you ever think about why some things have a price tag on them and some things don't? When you go to the hospital, if you're insured, you get to pay one rate. But if you're not insured, you get to pay a different rate, usually a lot higher. You know, maybe twice as high, 4 times, maybe 10 times as high as somebody who's insured. Now, if you were to walk into your supermarket and the guy in front of you paid $1 for a loaf of bread, and when the cashier rang up your loaf of bread, which was the exact same brand as the guy in front of you, same, you know, and they tried to charge you $5 or $10, I think you'd be a little upset. Now, wouldn't you? So why is it that we accept that in the healthcare industry? Think about it. I don't know. Is it fair? Is that a practice that maybe government should be looking in on? Why don't they? Interesting. Could it be because there's some hotel lobby or hospital lobby? Why do they say hotel? I guess it's the same thing, you're putting heads in beds. That's kind of funny when you think about it. But, hey, maybe when you get sick you should go to the hotel instead of hospital. It might be a lot cheaper. Anyway, that's off the subject. Now I can't remember what the subject was. Now I know. We're talking about the unfair practice where one person gets charged differently for the same service than another. I think there's a word for that. Discrimination? That's interesting. Well, you know, most of the time, you know, people get on camera or they write and they're ranting, but they don't have a solution. But I think maybe a few people put their thinking caps on the idea of a co-op when it comes to health insurance, and actually car insurance too, where instead of these for-profit insurance companies, we could have these quote-unquote non-profit insurance companies that are really there for the people. Is that a good idea? What do you think? Think it'll fly? Like I said, I don't know much about, forming insurance companies or co-ops, but I think somebody might be able to take that idea and expand it into a workable solution. What do you think? Let me know. Thank you.